Hello everyone, I am Arnika Thakur and I'm the editor of Femoai, and today we are starting our series of video interviews with doctors and healthcare professionals. And in this series, we will be talking about some of the most important issues that impact women and concern women's health. And today I have with me Dr. Poojashivam Jaitly. She's a clinical psychologist. Hi, Dr. Pooja.
Hi, Arnika. How are you doing?
I am very well. How are you?
All good, all good.
Thank you so much for being with us today. Like I said, Dr. Pooja is a clinical psychologist, and today she is going to speak to us about anxiety and grief, especially in the time of a pandemic when we are all experiencing some kind of mental stress as we are working from home and we have limited social interactions, which is bound to have an impact on our mental health, and especially for people who already may be going through some mental health issues, it's even harder for them. So I'm going to jump right into it. So Dr. Pooja, let's begin with if you could tell me about the kind of anxiety that people are experiencing during this time, and if people don't have access to professional help, what are some of the techniques that they can use if they feel anxious and they are unable to go through their day like they would in a normal situation?
So these are definitely trying times and very, very new. This entire situation is very new and very unpredictable. Again, two important components which are the breeding ground for any kind of anxiety. Anxiety is nothing but, our when we feel that we do not know, or we don't know what it is, and we won't be able to deal with a situation. That's when we feel anxious. And I think we are in a situation right now where everything is unpredictable. Every day brings with it a new finding, a new kind of fear. And the news, most of it is not very positive, or maybe because we are so programmed to look only at the negatives, that we are feeling very anxious. So
Right.
most people, not just people who probably were prone to anxiety, but I think people in general are experiencing states where they are where the fear element is more, where they're unable to concentrate, or where there are irritability in mood, where they have palpitations, sleep disturbances, interpersonal relationships are getting affected, communication skills are impacted. I think overall, these are the concerns that people are coming up with. The
Right.
anxieties usually are centered around, whether they will have this disease, whether they will have the virus, about their jobs, about the how when things will get normalized. So I think about future in general, and also about health. A lot of anxiety about health, and whether they're doing enough to protect themselves and their loved ones.
Right, right. So if people don't have access to a professional, how can are there any ways that they can probably deal with it on their own? I'm not talking about extreme anxiety, of course, but let's say if you're just feeling breathless, or you're unable to cope up with your daily chores, what can people do? Are there any simple exercises, maybe?
Yeah. So I think I'm going to break this question into two parts. One is that
Right.
we need to do certain things which are preventive, and one is when we actually experience something. So on the preventive front, I think it is extremely important that we do engage in some kind of healthy practices like pranayam, relaxation techniques, yoga, exercise, doing positive things, maintaining a diary of gratitude, and maybe engaging ourselves in pleasurable activities, and communicating with people with whom we feel close, and communicating our fears and thoughts, and maybe accessing less of news and WhatsApp updates on what is the new research on corona or the pandemic and its outcome. These are some of the preventive things that people should be doing in general. It's like kind of a mental hygiene which they need to maintain in order to cope cope with the current situation.
Right.
However, there are certain people who are likely to, despite this, feel very anxious, and may experience a slight panic attack at times, or maybe increased anxiety where they find it difficult to cope with or concentrate. I think in that situation, it's extremely important that you do practice relaxation techniques which are very easily available. Pranayam, which is an excellent way of calming yourself down. Also trying to understand what is the trigger which causes it, and breaking the thought which is negative, which is which is anxiety ridden, into more positive way of what you can do.
Right.
A simple exercise whenever you feel anxious, this is for anybody, is to concentrate on what you can control and what you cannot,
Right.
what is in your hands and what is not in your hands. Whenever you are faced with a situation in which you feel anxious, for example, in this pandemic only, what is in your hands is to wash your hands, maintain safe distances, avoid crowded places. These are the things which are in your hand. What is not in your hand is how it spreads, what the other person does. So I think whenever you're very anxious, concentrate on what you can do and what is in your hands rather than what is not in your hands and with what you can't control. Besides, obviously, exercise, relaxation, and etc. that I've talked about.
Right, right. But at what point should we be seeking professional help? And what are the ways to seek professional help right now? A lot of people are also unaware of what does seeking professional help mean. For example, what does it entail? So, could you tell us more about that?
Okay. So you and I, or anybody for that matter, can feel anxious at any moment, right? Anxiety is an integral part of our life, and we do experience states of heightened anxiety. Some amount of anxiety actually helps certain people, right? However, if it becomes so overbearing, and if it becomes extremely difficult to deal with, so much so that you find it difficult to carry on with your social, occupational, and personal functioning, you find it difficult to carry on with the day, and it's becoming like a pattern rather than just a transient state, that's a trigger for you to probably seek professional help. I think what is extremely important to understand here is that momentary anxiety is something which everyone experiences, and it's normal. However, if we see a pattern, if the frequency and intensity increases, we know that we probably need to go beyond just reaching out to our loved ones or doing things that we've talked about. The
Right.
help that is available is, I think it's growing by the day, because there are a lot of helplines which are available. There's therapists are available online. I'm conducting all my sessions online,
Right.
and yes, definitely, I and my clients are facing, I'm missing that touch, that human touch, and that sharing the same space. But I think virtually we are connecting very well. So please do reach out. There is no harm in probably reaching out to a professional and understanding. It's like if you have a cold and if it's not going, or if you have a fever, it's not going, and you've taken and done everything, you do seek a doctor's intervention. In the same manner, if your anxiety is taking over you and your life, then I think it's important to seek professional help, and it's very important that you go to the right source. Therapy at times, certain techniques, certain patterns of thought, I think they can be addressed by the therapist, and maybe in many cases you may not require medication. However, in some cases one does require medication, and that probably you'll be able to handle and take a call on it only after a professional intervention.
Right, right. We'll also be sharing some of these resources, hopefully, with our readers and viewers. I also wanted to, something interesting that I've been reading is that some psychologists have been saying that what we are experiencing at this time, it's not just anxiety, but it is also grief, because we feel a sense of loss of our normal lives. Things are not the same anymore, and it's not just anxiety, but it's also grief over loss. Could you talk a little bit about that?
I do agree that yes, a lot of us are experiencing grief over losing what was, our so normal for us. Also, at the same time, this situation is expecting a lot of changes from us, which we are not prepared for.
Right.
So yes, there is a grief, and grief, whenever we lose something, we do go through a period of grief, and it has its own stages of denial, anger, bargaining, and acceptance, and eventually coming to that, okay, life is going to be like that. And various people are probably at various stages of grief right now. However, I think what is challenging is, and what is most difficult is, that each day brings with it a new set of challenges for people, a new set of situations, which they are not which they've never experienced. So I think what is important is a kind of self-reflection activity that people can do at the end of the day, that what is it that they, how did they handle the situation, and how could they do it differently or in a better manner the next time. Because this situation doesn't seem to be going away, but we can be better prepared to deal with it if we reflect on our own coping skills and mechanisms. And I think taking each day as it comes, and maintaining a diary of gratitude, and maintaining a diary of our achievement of the day, I think will be something which is very helpful.
Right. Um, the other thing that is being talked about is how women are dealing with the pandemic. Of course, we know that women in general bear an unproportionate burden of housework, or care for children, or for older people. Speaking of women, there are a lot of women who have had a lot more work. Um, because their kids may be not at school, their husbands may be working from home, maybe there are elders in the family who need special attention. I wanted to ask you, how is it that they can first of all deal with it, or also how is it that they can speak to their partners or their family members about it and ask them to take equal responsibility, because not many women are kind of able to do that. So how can we make it, how can they make it easier for them? How do they speak to their family members and ask them to share some responsibility? Are there ways to do that?
Yes, I think it is extremely important that women draw certain boundaries for themselves and for what they can do. We have this thought process in our mind that we need to carry on with everything, and we need to provide. We take this provider role very seriously, and more so now that we are homebound, we feel that we need to provide for the family more than what we were when we were not at home. What
Right.
women essentially need to tell themselves is, and especially the ones who've been working from home and who are working women, that they are even though they're working from home, they are away at work.
Right.
So they need to draw boundaries. They need to first is acceptance at their level, that
Right.
there's only so much that they can do. Even women who probably were homemakers, they also need to understand that they do not have the kind of help which was available to them. So
Right.
they need to understand their limits. They need to understand what they can do, what is physically possible, and first is their acceptance of it.
Uh-huh.
The moment that comes, then they'll be able to communicate that better with their family members.
Right.
I think what would really help them would be to prioritize and say that these are the most important things which I would be doing
Mhm.
on a regular basis, and these are something which probably the weekend can take over. These are the things which I can take care of, and this is something which individually each member has to do. And if they're unable to do it, then it's fine. It's not really their responsibility to provide for that.
Right.
I think having a talk with their family members, with their partners, with their children, involving children in daily chores. I think all of that is going to help. But I think it has to begin from acceptance coming from women themselves, that they cannot do everything.
Right.
They can't be the MDR lady that we see in the ad doing, making all the dishes at one go with 8 hands and things like that. I think that's very important.
Right, right. You know, a very common question that people have is that, you know, when your friends or your family members or your relatives who might be anxious, who might be going through something, who are depressed, when they come and speak to you, I mean, we are obviously not equipped to advise them or tell them what to do. So what is the best way to handle that situation? What is the right thing to tell them?
I think I would like to bring in here the fact that a common thought that is emerging is that everybody seems to be becoming an expert in mental health.
Right.
I think what is very important is there is a difference in being, addressing somebody's mental health concern or being a good listener.
Mhm.
You could be a good listener, I could be a good listener, but to be a mental health professional, there is a certain amount of training that one undergoes.
Right.
If you have somebody in your family or friend who's undergoing a state which is maybe anxiety, maybe depression, maybe you don't know, but yes, the person looks disturbed. It's okay to be there. It's okay to be available, to let the person do catharsis with you. But I think if it's becoming a pattern, it would be, I think you would really help your loved one, whether a friend or a family member, by accompanying or supporting that person to seek professional intervention.
Right.
It's, we need to treat mental health in the same manner, or probably more importantly, like we do in a physical health. If you would have a physical condition, physical health, or if you would have a health condition, you would actually go and seek a specialist intervention. You would not try and intervene there, right? In the same manner, mental health concern, it may seem very easy, and it may seem that you can say that, oh, don't take life too seriously, or don't think this way, and or change this way. Well, you might do more damage than actually help the person. So I think if you have somebody around you who's actually going through a state of maybe disturbance, and you don't know what it is, be supportive, be available, but also try to revisit the thought of seeking professional help. Maybe that might help. And the ease with which you will say that, I think the acceptance of seeking mental health will come in the population automatically.
Right, right. I have also been reading that you know, women are almost twice as likely to be anxious or to be depressed compared to men, which I'm quite curious about. Like, is that so? And if it's true, why does that happen?
So there's a whole lot of research which has gone into this, and which does support the data that women are twice as likely to develop anxiety and depression symptoms than men.
Huh?
There are a couple of reasons for it. I would like to say that it's individuals who are more predisposed or likely to develop these, mental health conditions.
Huh?
But in why do we have this kind of a data, or why research support this? There are many reasons. One, biologically, or we have women who go through certain changes, hormonal changes, which kind of affects their mood and their, anxiety states, or, the way they feel and perceive things. So, for example, they go through puberty, hormonal changes at that time, then childbirth, then menopause, all of this. So this, it predisposes them, because there is a reason why, certain hormones might trigger a kind of mood or an emotional state which might make them more anxious or affect their mood, or may make them feel more sad. The other is that women are probably reporting it more than men. We are conditioned, as the society, the gender difference, that oh, men though don't feel this way. I have seen that a lot of men hide their anxiety and sadness, because they're not supposed to feel that way, and many of them have actually accepted that this in the course of therapy, that yes, they can go through these states. So because women are reporting it more and men are not reporting it, that's why also we have more data related to that. And the third reason is, psychologically, I think it's how your mental makeup is and how you are as a person. Because whether you're a man or a woman, if you're more sensitive, if you're more prone to, probably to be affected by certain triggers in your environment, then I think that is something where you might experience certain states more than what somebody else would. So I feel these are the reasons why women are likely to experience more. I feel it's more reported, and they also have certain reasons, like I said, biological reasons. That is the reason why we have more data to suggest that. However, I feel that men are also experiencing it, and the sooner we normalize talking about men experiencing these states, the better it would be for their mental health.
Right, right. Well, these are all the questions I had for today, but we will come back to you very soon, because I'm sure there is a lot more that we can speak about. This has been personally very interesting for me, and I hope that our readers find it interesting as well. So thank you so much for taking out the time to speak to us, and I hope that we can do it really soon again.